A section of the 2,300 public hospitals doctors assembled at the Kenyatta National Hospital Wednesday morning, from where they set out on a protest march. The demonstrators disrupted traffic along the usually busy Ngong Road as they made their way, chanting and carrying placards, to Afya House near Uhuru Park. There they intended to seek an audience with Medical Services Minister Professor Anyang' Nyong'o, but found that there was nobody to address them or listen to their grievances. They then made their way past the Prime Minister's office to the Treasury building, both on Harambee Avenue, before marching back to Parliament. Late in the afternoon, the Ministries of Medical Services and Public Health would reach out to the Doctors' Union. Assistant Minister for Medical Services Kazungu Kambi tabled what he termed a renewed and improved offer. The 30,000 shillings a month in extraneous allowances remained unchanged, but doctors would now receive increments to the full amount in 2 installments in the space of 7 months instead of 3 years as initially planned.
It amounts to a gross pay for the doctor, the neurosurgeon and the cardiologist of just under 15,000. After tax, it will come to about 10,000. So the government offer per doctor currently is as of December. Then the doctors who will benefit from this, because there's another card I'm going to talk about that don't benefit from this, will take home, will have a gross increment of 15,000 and a take home increment of 10,000. And this is for the professor of medicine, this is for the cardiologist, and this is for the neurosurgeon.
Further, the ministry maintained its offer of 200 million shillings for training purposes, as well as a proposed 80 billion shillings for health financing over the course of 10 years. But this was not enough for the doctors.
The offer that is being made currently ignores a lot of the proposals we had made. This is not just about paying doctors better. It's about improving the public sector healthcare provision. And there are very many wheels in this axis. And a lot of these things are taking us back.
The doctors say the government should deal with doctors as an entity and not including all other hospital staff, even as Kazungu pleaded with the doctors to abandon the strike.
As a government, we have managed to actually bring more money, a better offer than what we did. So I think the most honorable thing we should do as honorable people, civilized people, we should sit down and say, well, we are calling off this, but this is what we need. 1, 2, 3, 4, 5, 6. There are those things we can do. That's why we are doing them.
The talks got so heated, Permanent Secretary Mary Ngare walked out ostensibly to attend to other matters, leaving doctors to ponder over the offer and make a decision. Meanwhile, lives were lost at the Kakamega Provincial General Hospital as a nationwide strike entered day 3. 4 people at the facility, which acts as a referral for hospitals in Western Province, died as they awaited medical attention. It is not clear if they could have been saved had they been attended to by a doctor. A spot check by KTN in one of the wards was a clear indication that the strike is taking its toll. The body of a man who had died hours earlier was left in the wards long after his death. The Doctors' Union is in a closed-door meeting to deliberate over the offer made by government officials. Wilkis Anyabwa, KTN Prime.